Hello, everyone. My name is Phoebe Gorges, and we have Jillian Bartman and Taylor Childers here. And our project is called the Crisis Counselors. It is an education and prevention of opioid misuse in students and families program. We have a motto that we'll share with you all and some information that goes along with it. A little introduction about our program. We've been seeing an uprise in mental health concerns among teens, mostly in the high school ages. So this is a proposal for a need for more psychoeducation programs for students in the schools. We would like this program to be similar to the Naviance Career programs that we've been seeing in our schools that we've been exposed to. And what it will do is it will follow the students from K to 12. It's a K to 12 program. And each year there will be an age appropriate assignment or group assembly, educating them on a specific topic that we feel relates to drug abuse as well as other mental health issues. And then we want to pretty much provide tools and resources necessary for these students to thrive academically, emotionally, socially, and even beyond in life after high school. There is not currently national programming about drug and alcohol abuse in the schools, and we believe there should be, and we saw this need, and this is the program that we would like to implement. As you can see from this little chart here, drug addiction in teens, anxiety and depression do top the list of problems seen among their peers in teens. This is very common for us. We see at our clinical school sites, we see a lot of students that come in with anxiety and depression ranging from K to 12, as well as the second one being bullying. What surprised us, though, was that the third was drug addiction. And we are seeing this more and more, whether it's in the student themselves, or maybe they express that a family member is in rehab or has used drugs or alcohol themselves.
So before I jump into our mission, I kind of wanted to touch upon the inspiration that we found for this project. As Phoebe kind of touched upon, we all have been in schools, different schools throughout the past year of the program, and we've really gone to see the effect of opioid use disorder and other substance abuse disorders from K through 12 in our area. So that's kind of where it stemmed from. We saw that schools had their resources available for students to do things such as career planning, and that kind of lit the fire to why can't we do this for drug and alcohol use. So our overall mission is to educate students from K through 12 on three major things, and that's opioid use disorder, alcohol and other drug use disorders, specifically with the prevention, treatment, and recovery. And we also, throughout our program, we also want to provide students with resources. So that's not only going to be broad resources that can be found nationally, it'll be specific to the county that district is within. That way their family has resources and them as an individual. So for our plan, how we want to implement this, it would be done through different activities, as Phoebe mentioned. These will be different assignments and archetypes that they would complete each year. And as she said, it would follow them K through 12, so it would kind of build each year. Something that piqued our interest was a walkthrough symposium that utilizes different individuals that have suffered from OUD and SUD throughout their life. Something like this would obviously be only available to our older students, but that is something we would love to open up to parents in the community in general. And of course, we're going to have some educational assemblies. Those things are going to cover how to say no in situations that aren't necessarily always related to drugs, but build upon to saying no to drugs. And depending on district to district, we may have, we may have specific groups or assemblies that address specific needs in that school.
And then next is our motto, which is everything you do is for your future. Are you making yourself proud? So, our motto, we want our students to really think about their futures during these assignments or assemblies to really educate themselves for a successful future.
So I just kind of wanted to throw some drugs and alcohol facts out there because, as most of us probably know at this point in our education, they are going to be something that we all face, whether it's with our students or a family member, a friend, or someone they come in contact with. So 39.7% of children ages 12 to 20 years old reported having at least one drink in their lives. And 21 million Americans have at least one addiction that they battle with daily. 40,000 individuals a year, or 115 a day, die due to an overdose in the United States. In this next fact, I picked out as all three of us are from the local area, and I know a lot of Cal U residents are too. So this is one that kind of hit the subject for all of us. In 2017, the study showed 5,456 drug-related overdose deaths in Pennsylvania. This number represents a rate of 43 deaths per 100,000, for exceeding the national average of 22 per 100,000. So that's simply saying that in Pennsylvania, the overdose death rate is nearly 2 times the national average, something that certainly needs to be dealt with.
So, based on some studies, the results in studies suggest that attempting suicide is common among opioid dependent individuals. So, in addition to being addicted, there are also additional risk factors that might play a role. Up to 40% of patients seeking treatment for substance dependence report a history of suicide attempts. So, it's almost half of the patients. Suicide behavior is a significant problem for individuals who are addicted to a substance or in addiction treatment. And then additional risk factors play a role in the suicide attempts. So, not just the addiction, but also additional factors as well. So, many of the risk factors that were found to be a result of addiction behavior um, or led to an addiction. So, I have this in quotes. So, it says risk factors such as marital or interpersonal relationship disruption, occupational or financial stressors, recent heavy substance use and intoxication, as well as a history of previous suicide attempts and sexual abuse combined in an addictive fashion with personality traits and mental illness.
Along with the suicide and addiction, we would also touch on, this is another topic that we would try to implement into our program, is pregnancy with drugs. So this would be something that would typically be discussed in a health class in most schools. However, we would want to make sure that this is more related to the drug use and the drug misuse. So the National Institute of Drug Misuse created an article in 2020 on the effects of drug misuse. Drugs can affect many aspects of our lives, one of those being women in pregnancy. Studies show that various drugs may result in miscarriage, premature birth, low birth weight, and a variety of behavioral and cognitive problems in the child. In addition to all these listed, when the baby is born, it can become dependent on the drug that the mother is using. So we would want to make sure that girls and boys are, familiar with these facts and understand the consequences that could come when using drugs or alcohol during a pregnancy.
So, as school counselors, it's crucial that we understand the relationships that our students are having with their families and other relationships they're holding. So, if they are having someone that has an opioid use disorder or an alcohol, or excuse me, substance use disorder, it's greatly going to affect their behaviors in school and outside of school. So, just to give you an idea of how many students are affected, 8.7 million children ages 7 or younger have at least one parent who suffers from substance use disorder. When a child has a parent that suffers from substance use disorder, they are at a higher risk for experiencing abuse, neglect, or indirect effects such as fewer household resources during their childhood. Additionally, when they have a parent that suffers from SUD, the children are at greater risk for depression, anxiety disorder, and problems with cognitive and verbal skills.
So in addition to having family issues, there's also graduation rates that correlate to addiction as well. So there were findings that had three main categories with graduation rates and addiction. So students who were um, employed were 2.5 times more likely to graduate. And then this was based on a study. And then participants who were using um, opioids as their primary drug of choice were over 80 times less likely to graduate. Um, and then the third main category was that participants who had violations in the first 30 days of the program were nearly 50% less likely to graduate. So then graduation rates improved when medication assistance was provided. So when medication was involved, resources were offered to the participants. So whether that was, employment or secondary education. But overall, it has been found that providing education and resources for individuals who are addicted is very essential for an increased graduation rate and also just future success in general.
Overall, mental health and wellness is a big topic when we talk about drug misuse. Drug use and mental health are very closely related. It is easy for a doctor to prescribe medication that will help an individual with a mental health issue and with an overall physical ailment. However, one must be concise of how some drugs can be addicted. Um, so many people who are addicted to the drugs are also diagnosed with other mental health disorders and vice versa. So some statistics that we found from a study show that half of adults experience some form of mental illness. Now, that doesn't say that they are into like a drug misuse or a drug abuse situation, but these people have a mental illness, and that does not stem from a developmental issue or a substance use disorder. From the study, though, 8.1 million had both a substance use disorder and another mental health illness. So they can correlate. Although substance use disorders commonly occur with a mental illness, it's often unclear whether one helped cause the issue or if there's a common underlying risk factor that contributed to both disorders.
So overall, there are many risk factors that come into play for individuals who are addicted to opioids and other substances. Many addicts find themselves faced with suicide and other major behaviors that we discussed. Someone who's addicted usually it doesn't just affect themselves, but the lives around them, their families, their peers. Um, it is important to educate the youth as well as their families who are suffering due to having a loved one who is addicted. If we can prevent even just one youth from becoming addicted, it is worth the effort.
And these are just the resources that we use throughout our presentation.